Meeting to order. Mission statement of the Seneca County Board of Health. The General Health District, in collaboration with its citizens, promotes wellness, prevents disease, protects the environment, and ensures access to quality health care. Roll call, please.
Mr. Watson,
Here.
Mr. Lyon,
Here.
Ms. Posey, here, Dr. Sewell, here, Mrs. Vitt, here, Mr. Watson,
Here.
Dr. West,
Here.
Dr. Wolf.
Here. Thank you, pledge allegiance.
Of the United States.
Meeting education tonight is with Chris Kalen from the WIC program.
So Trish, continuing in the series of Foundation for Public Health Services, I've been focusing on the foundational area of women, specifically the program is women, infants, and children, but it's in the maternal, child, and family health care. Take it away.
Okay, thanks for hearing from me for a few minutes. Just to give you an idea of the scope of WIC in 2022 in the United States, over 6 million moms, babies, and children participated in the WIC program. That's about 43% of all infants born in the United States, and then 20% of all children between the ages of 1 to 4. We do serve up to the age of 5 years old. The month they turn 5, they end their benefit. So I think that's why the statistic is 1 to 4. I do have a sheet with some more Ohio specific information that I will pass around if you want to take that. And then locally, when I give you the numbers for participants each month, that's the number of individual people using WIC benefits. So for February, it was 1,002. That means we had 1,002 people utilizing WIC benefits during the month of February. If there are other stats that you are interested in knowing, you can just let me know and see if we can get those for you. We do have state reporting systems that has a large range of information. So if you want anything specific, let me know. I'll see if we can work it out. Ian mentioned the area of maternal, child, and family health is the foundational area that we are working within. And then the capabilities, equities across all areas. So we're working on that, community partnerships, communications. So, you know, some of that works into our program as well. This slide is a little bit wordy, but it just describes our funding. So we are federally funded. We are a discretionary program, so our funding goes through the appropriations process. It's the federal funds that is delivered to the states. That's delivered in 2 different streams. One stream pays for the food benefits, that pays the stores for their WIC dollars used. And then the other stream goes to administering and operating the WIC programs. USDA has specific funding formulas that they use. So locally, we have really no influence over the grant dollars we get. We just get what is assigned to us. And then we have to decide how we're going to provide services utilizing the amount that we are provided. The overarching goal is to help improve health outcomes. We are a need-based program also, so you must demonstrate an economic and then a nutrition or health-related need in order to participate in the program. In order to improve health outcomes, we do focus on 5 core services. One is increasing access to healthy foods. So you will be provided a monthly benefit of WIC food. The food packages are specific. We do have the strongest nutrition requirements of any federal program. They do adhere to the dietary guidelines for Americans, and they also undergo scientific reviews. That process is a continual one, so they're continually reviewed. The food packages, they're tailored also to meet specific participant needs. So each participant will speak with a new nutrition professional. Right now, our staff is myself. I'm a registered licensed dietitian. I've been with the Seneca County WIC program for almost 7 years. Prior to that, I was with the Tri-County Hancock Garden and Putnam program. And prior to that, it's probably just going back too far. We also have Ann Klauka. She is also a registered licensed dietitian. She has been with us almost a year now. She has a wide variety of experiences, a lot of counseling in a different variety of settings. She's had instructed classes at the college level. She has fitness certifications. So she has a good background of health knowledge and a lot of counseling experience. And then Sherry Jordan is a registered dietetic technician. She has been with the Seneca County WIC program for about 16 years, a long time. So the nutrition professionals tailor food packages to meet their needs, and then we also provide the nutrition education. So we'll talk to them about how to use the foods, how to shop for their foods, specific foods that might help meet their needs, or if there's a health issue that they have. Because it's very individualized. They receive all individualized counseling. So they will speak with the nutrition professional on that. We really try to empower them to make their own healthy choices and make goals for themselves. Twice a year, they're in our office, and for those 2 times, they set a goal for themselves. So what is specifically important to them? And then we just try to help them reach that. Our third service is breastfeeding support. So we do have myself, I'm a certified lactation counselor. And then we have our peer helper program. After Erica left us, the peer program, we have Stephanie Hayward now. So she's been with us a little less than a year. She is a mom with over 4 years of total breastfeeding experience. So she's breastfed, she's got 3 kids and a total of over 4 years experience. She makes frequent contact with the moms, tries to provide anticipatory guidance, what to expect, how to get started. We will bring people in for latch assessments. And again, just try to help them reach their specific goals to breastfeeding. And then we also engage within the community. We had a display at the Y for breastfeeding a month this past year. So that's a picture of that. There's a support group at the hospital that just started a couple months ago. I think we're on the 3rd month. Our peer is going out with that with their IBCLC. She's going out there monthly with Emily. 4, we do some health screenings. We do routine weight and height checks, and then we also screen for anemia. This has been put on hold during the pandemic. Federal waivers granted permission not to bring people in for those screens. We are probably going to be starting within the next quarter, returning to in-office and doing weights, heights, and hemoglobin checks. And then last, we refer out. So we'll try to connect you with care or resources that are needed for the things that we can't help you with. We have memorandums of agreement with local physicians to refer for healthcare, and then just really maintain community awareness for resources if there's needs, that the participant has, so we can tell them where to go.
Well, I have a question concerning actually the food supply.
Mhm.
You mentioned healthy foods. Is there any hard or difficult access? Is it availability there for everyone locally around here for the healthy foods that you're recommending? Or is
There's a
there
specific foods,
Yeah.
that's a long process, establishing the foods that are allowed to be on WIC. So
are they available though? I was wondering if they're around here.
yes, we're fortunate to have Kroger, Walmart, and IGA participate in the WIC program in Tiffin, and the Kroger in Fostoria, the Mexican store in Fostoria, and then I know the Save-A-Lot's not really Seneca County, but they also take the WIC vouchers there. We're fortunate to have that.
Okay.
There are areas, yes, where traveling to grocery stores might be more significant
Yeah,
for,
gaps.
yes,
All right.
yeah.
Thank you.
I also don't want to mention, we have a long-term support staff. So our WIC clerks we have 2 WIC clerks, and they've each been with us for about 30 years. So, they're the real runners of our program. Other questions?
Can we talk about farmers market and what you guys do related to that?
Farmers market is a separate grant too. Not every county does participate. We do here. I think those numbers last year was about $2,000 that farmers received from WIC benefits. We distribute more coupons than that, so it's always, we're trying to increase that usage rate and think of ways to increase that usage rate. I think the Fostoria market last year decreased the number of times they were open. Were they only open?
Oh, I don't know.
I
the
think it was every
details.
other Saturday and then a Thursday of the month. And Tiffin seems to be increasing their farmers market to, weekly, so that also helps. Again, going back to the access.
How much do they get?
Each participant, yes. Okay.
All right. Can I get a motion for the approval of the revised consent agenda? Okay, we have approved. Second. Second. Any discussion? All right. Oh, that was low. Oh, I'm sorry. All in favor? Aye. Any opposed? All right. Motion passed. Next is the action and discussion items. Health Commissioner, do you want to go through? Yep.
So, start with noting that our DAC meeting, which is an annual meeting, occurred on Monday. And so related to that, there's two resolutions that appear on the agenda today, recognizing two of our more experienced board members. And then also related to people was just provide an update with the efforts to fill 3 full-time positions. The epidemiologist position we thought we had filled, but then the person got a much better offer that no health department would have been able to match. So we're starting over with that process and re-advertising. The health educator position, I believe we have a candidate coming in tomorrow for a second interview, and then the health planning and accreditation manager. We're doing reference checks right now. Under our quality pillar related to Sunny Farms, we specifically reached out to our emergency response partner, John Spar, the EMA, to help respond to questions that were raised at last month's board meeting that Brenda Kuhn kindly sent to us in writing. And so you each have a copy of those in your packet, and we also provided copies in the back. In addition, Eric had provided information via social media on our water testing program and how to interpret those results. And so we did put copies of those in the back as well, if you didn't happen to see those via social media. And then an ongoing communication strategy. As a health communication specialist, Eric is taking charge of the strategy to take questions and respond to those questions. And so one of the other materials that was in the back was a QR code. We're asking individuals to submit their questions via that QR code so that she can compile those and then get them out to the right people to get a response. And then we'll have an email address to be able to send those responses back to. And if more than one person asks that question, then she can send that response back to all those individuals that asked that question. And let's see, the other thing, working on hopefully 2 YouTube videos, working with a local videographer to create one that features Austin and the private water well testing process. So once spring is here and he starts doing those tests, they'll actually be explaining the process. And then the second one that either we or Ohio EPA will do is one related to a landfill inspection. because that was an idea that I had already submitted to Ohio EPA several months ago to ask them if they would consider doing that, and they are interested in doing that, but if they don't, then we are interested in doing that, so that a person has a visual explanation of the inspection process. Related to the air quality monitoring stations, we continue to meet every other week, or mostly every other week. We did have one meeting that was canceled earlier this month. But we've made some property owner contacts regarding property easements. We're working through that process. And our consultants are working on the documents that will be necessary for a sealed competitive proposal process. All of that. Will need to go through prosecutor's office. Related to growth. Want to recognize and thank Erica for the work that she spent on our annual report, which is in again. Your mail. And that's also been shared via email and and via social media as well. I know we're still talking about comments, but I don't need to talk about it. And then related to finance, wanted to share. Last month I mentioned the House Finance, the budget bill that's now before the House Finance Committee. We actually completed the review of the 4,500 pages of that document bill. And there are several items that the State Association of Health Commissioners are supporting or opposing in that document. The first that we're strongly supporting and asking the Finance Committee to vote affirmatively on relate to funds for evidence-based community health interventions. This is new funding that would go to local health departments to support evidence-based interventions that improve the health of communities around the state. We could utilize the funds to address local health priorities that are identified in the local community health assessments and community health improvement plans. And this represents the first significant increase in state investment in local public health since the 1980s, and represents an important first step in addressing chronic underfunding of local governmental public health. For decades, the state budget has included a small appropriation of state general revenue funds of 17 cents per capita for non-accredited health departments and 34 cents per capita for accredited health departments, in comparison to $4.26 per capita in Indiana, $4.23 per capita in Kentucky, $5.16 per capita in Michigan, and $4.30 per capita in Pennsylvania. So all of our neighboring states make significantly greater investments in their public health departments. AOHC is also supporting several other provisions that were in House Bill 33. One of those is enhanced tobacco enforcement and prevention measures that include prohibitions against the sale of flavored tobacco products to youth, the regulation of the sale of vaping products, And then an infant mortality scorecard that will present updated infant mortality data to the public. There's proposed changes for scrap tire incident cleanup. In the past, there were funds only for a portion of that. But this, if it is passed, it would provide funds for the total cleanup, including the solid waste and construction demolition debris, the entire cleanup, not just a portion of it. There is a provision related to child restraint usage that would move it from being a secondary offense to a primary offense. So it makes it a primary enforcement. A sales tax exemption for child personal care items such as diapers, therapeutic or preventive creams and wipes for children, child restraint and booster seats, cribs, and strollers with families and the care to help them with the care and safety of the kids. An increase in the Medicaid dental reimbursement rates. Medicaid has not changed, it's been chronically low. It makes it so that dental care is one of the highest needs in the entire state from a healthcare perspective. And those services have been chronically low for many years with no significant increases in over 20 years. And Ohio actually ranks 42nd in the nation for the reimbursement rates for child dental services. And so there's a lot of dentists that do not serve clients with Medicaid. So it's a case of where, yes, having insurance is nice, but if there's no provider who takes your insurance, it doesn't help you. And so this is considered to be a positive first step in improving access to dental care for our most vulnerable residents. And then finally, strengthening the authority of the Environmental Health Specialist Advisory Board. So for individuals that are registered environmental health specialists, there are some key provisions that are important to them that AOHC supports. We strongly oppose one specific provision, which is changes to the home sewage treatment system program related to dry wells. The proposed changes would change how quickly dry wells would have to be eliminated from existence. They're currently not allowed for new installed systems. There's many systems in the state that have existing dry wells. As long as they've not been a nuisance, those have been allowed to continue. However, the wording that has been proposed would actually make it so that all of those had to be eliminated within 10 years, regardless of whether they were creating a nuisance or not. So AOHC opposes that because the focus is on, is it a nuisance, not just, is it a dry well? So those are the finance related items with the state budget bill that were identified. That's all.
I have a question. Do we have for the Heidelberg's COVID-19 planning and response team, is that like involving their vaccination requirements, or what are their guidelines compared to other schools for the recommendations from that?
Well, they established their own, so that's their internal planning team.
Okay.
And they, from the very beginning of the pandemic, involved the health commissioner. So that's prior to me and then me, to provide them with what's the community context. Because in the guidelines that were set out was that you make decisions for your campus, but you need to know what's going on in the community around your campus. Because not everybody lives on campus. Lots of people, are county residents and with import cases or whatever. So, at that particular meeting, we were talking about the change in, the federal declaration ending in May and how would they change what they're doing as a result of that. So.
Are they about on par for what other schools are doing? Yeah.
I don't know what other schools are generally doing. They were certainly very, I would say progressive in staying on top of what the guidelines and recommendations were, more than other campuses or universities that I work with.
So we just provide them with like data and.
Would it be possible to, in your report, elaborate a little bit on some of the topics when you give us your documentation or your activity report on what was sort of the nature of the things that were being discussed?
Well, if you'd like me to change the report, certainly I can do that. I wasn't given any guidance for what you wanted in an activity report, so I simply have crafted it the way I've crafted it.
Sure. I'm just asking for a little bit more elaboration on some of the topics being discussed. Or get that, those meetings.
So more oversight over what I'm talking with them about.
No, just highlight the topics, so we know kind of what's being discussed from a health department standpoint on the COVID vaccine response with the university during the jurisdiction.
All right, next we are to personnel actions. Number one is to accept the resignation for purposes of retirement for Patricia Elker, public health nurse, effective 4/5/23. And I'm going to do these with a roll call vote, just because the others are regarding board members. Can I get a motion to accept number one for Patricia Elker's retirement? So moved.
Second.
All in favor, say aye. Or wait, any discussion? All in favor, say aye.
Aye.
Any nays? No? Okay. Next, this is resolution 2023.05. This is a resolution expressing the appreciation to Bonnie Boroff for her service on the Seneca County Board of Health. Whereas the Board of Health of the Seneca County General Health District acknowledges the public service provided by Bonnie Boroff during 2 terms on the Seneca County Board of Health from 2005 to 2008 and from 2013 to 2023 as an appointee of the city of Tiffin. And whereas the Board of Health recognizes Bonnie's belief in the value of having a local health department governed by a local board of health as demonstrated by her consistent attendance and participation in board and committee meetings over more than 14 years. And whereas the Board of Health honors Bonnie's consistent treatment of community members, fellow board members, and health district staff and administration with courtesy and respect throughout her tenure. And whereas the Board of Health is grateful for Bonnie's commitment to meaningful and productive dialogue amongst board members with the goal of achieving consensus decisions that support the goal of preventing disease, promoting wellness, and protecting the environment for the residents of Fostoria, Tiffin, and Seneca County. Therefore, be it resolved that the Board of Health of the Seneca County General Health District expresses its sincere and deep appreciation to Bonnie Boroff for her dedicated service and efforts to protect and improve the public health of the Seneca County residents. Bonnie here. Thank you, Bonnie, if you're watching this.
Move to adopt the resolution.
Second. All in favor, say aye.
Aye.
All in favor, any nays? Okay, next, 2023, resolution 2023.06. This is the resolution expressing appreciation to Robert Watson for his service on the Seneca County Board of Health. Whereas the Board of Health of the Seneca County General Health District acknowledges the public service and fiscal leadership provided by Robert Bob Watson as an appointee of the District Advisory Council on the Seneca County Board of Health from 2015 to 2023. And whereas the Board of Health recognizes Bob's commitment to having a local health department governed by a local board, as demonstrated by his consistent attendance at and participation in board and committee meetings over the past 8 years. And whereas the Board of Health acknowledges Bob's unparalleled financial expertise and attention to health district finances as the chair of the board's finance committee for the past 8 years. And whereas the Board of Health honors Bob's respectful treatment of community members, fellow board members, and health district staff and administration during his tenure. And whereas the Board of Health appreciates Bob's engagement in meaningful and productive dialogue with board members and with the goal of achieving consensus decisions that support the goal of preventing disease, promoting wellness, and protecting the the environment for the residents of Fostoria, Tiffin, and Seneca County. Therefore, be it resolved that the Board of Health, Seneca County General Health District expresses its sincere and deep appreciation to Robert Watson for his dedicated service to the efforts to protect and improve the public health of Seneca County residents. Thank you, Bob. We appreciate it.
I'll move to adopt the resolution.
Second,
Okay.
all in favor, say aye.
Aye.
Next, we have the out of county travel. I'm gonna go through all of these. And then take a roll. Out of county travel, 3A, $30, PHEP planning meeting, Fremont, Ohio, and June, on 3/2/23. 3B, $35, introduction to outbreak investigation, Bowling Green, Ohio, Miranda Cole, 3/17/23. 3C, $120, World TV Day, Columbus, Ohio, Gene War, 3/28/23. 3D, $200 to the local government officials conference, virtual, Anita Gallardo, 3/28 through 3/29/23. 3E, $160 to the Midwest Workshop, Columbus, Ohio, Matt Beckman, Austin Eniger, Nikki Roomschlag, 3/30/23. And 3F, $125 to the Ohio Public Association of Public Health Nursing Section Meeting, Andrea Barrel, 8/11/23. That is all for that. Can I get a motion for those expenses?
Make a motion to approve.
Yeah, first, can I get a second? Any discussion?
Just quick clarification on D,
Okay,
it says $200, just says virtual, so I don't understand.
So it's a virtual conference, but you had to pay a registration fee to
It's a
attend.
registration fee, not a travel. Okay, thank you.
Yeah,
That's
the
what
travel includes registration fees and other expenses related to.
I knew it was something that just
Yeah.
says virtual $200, so I asked the question.
no, any other discussion? All in favor, say aye. Any opposed? Resolution, our motion passes. Number 4 is the out-of-state travel for the National Preparedness Summit in Atlanta, Georgia. 4/24/23 through 4/24/27. Is there a?
So yeah, there's additional information that's missing there.
I see that.
This is for Miranda Kale and Betsy Miller to attend, with up to $2,000 of the travel expenses covered by the regional PEP grant, which is the Public Health Emergency Preparedness Grant, with the remainder covered by our Public Health Emergency Preparedness Grant.
Can I get a motion to approve that? First, do we have a second? Any further discussion? Okay, that passes. Next, Jim. I'm sorry. All in favor, say aye.
Aye.
Any opposed? Next, we are to the financial transactions. First is the payment of bills.
So the first page is a summary of the highlights of that, but then the bills themselves are all the related documents attached.
Right, can I get a motion for those? And then a second.
I'll second that.
Is there any discussion on those? All in favor? Say aye.
Aye.
Any opposed? All passes. Next is to approve the 2024 appropriations.
which is an offering page document, your packet is stuff. So according to revised code 3709.28, the Board of Health must approve an itemized appropriation measure. If you receive any part of the revenue from an appropriation that's apportioned among the members of the DAC, basically, if it's apportioned among townships and municipal corporations. And so that's why this is before you. So you can see overall for 2024, the anticipated revenue there as far as proportions. Dollar amounts are on another page, but you can see that the majority of funds, 60% of funds are CNDD fees, with another 7% that are services for other environmental health programs. About 13% of our revenue is anticipated to come from grants. And that proportion has changed over time as we've completed or wrap up the pandemic response efforts. Fees for services are those that are related to either birth and death records or immunizations, nursing services. The levy, you can see, brings in 7% of our funding. The budget commission, meaning the portion that comes from townships and villages, that accounts for just 3% of our overall budget. And then there's several others there. You can see they're much smaller parts. For example, the state subsidy of 34 cents per capita accounts for 0.4% of our budget. Contracts are just under 3%. So then on the following, the two yellow pages are the revenues and expenditures for our two largest funds. We have one general fund, which is the only unrestricted fund. So when there's a grant program that, and they all require this, that you have to spend the money first before you get reimbursed, this is the only fund that we can advance money out of to do that. You can't move money from one restricted fund to another. You can only move it from the general fund into a restricted fund. And then when that money comes in, then it gets paid back to the general fund. So the Board of Health General Fund is our primary fund. And then the other one that is obviously large relates to the CNDD, or construction and demolition debris, which is a special revenue fund. We have 23 special revenue funds. So each one of those is restricted by either the funder or by law on what it can be spent on. And then we have one custodial fund where we are the ones that hold or serve as the fiscal agent for the Health Alliance, which performs the community health assessment and community health improvement planning work. So those are funds that we can't touch. They're just monies that all the members contribute, or many of the members contribute to help pay for those services every 3 years when those are done. So there you can see the actual dollar amounts for 2022, the estimated what's in the current budget for 2023, and the anticipated for 2024 for each one of those revenue sources in the for the Board of Health General Fund, with the fund total going down actually for 2024 to $2.0 million. And then the expenditures, proposed expenditures out of that fund for the same period of time periods. Actual 2022, estimated 2023, and anticipated 2024, totaling just over 1.5 million. And there's lots of services that fall within that general fund. Nursing services generally are all in that fund. Administrative services, vital statistics. Most of health planning and accreditation is from that fund. It is the primary funding source for those foundational capabilities that we're required to have in place. The CNDD special revenue fund, you can see that it has one sole funding source, which are fees. So between the beginning balance for what's anticipated in 2024 and the income, that fund will be approximately the income will be approximately 7.4 million, not quite 7.4, but and then the anticipated expenditures. You can see there the largest expenditure is the remittance that we make to the state or to other entities. It's not just the state, but the entities that receive a portion of those funds are Loudon Township, the county, and then the Ohio Department of Natural Resources and the Ohio Environmental Protection Agency, Ohio EPA. So that the anticipated expenditures are 3.6 million. And then what follows after that are the revenues and the expenditures for each one of those special revenue funds. So for example, the first one is the swimming pool program. So the income there comes specifically from fees, the fees that public pools pay. And those solely support the staff that work in that program and the services that are related to that. Portion of those fees are passed on to the state, which is true for all of our environmental health programs. We're required to collect the state's portion of fees and pass those on to them. So swimming pools, solid waste, trailer parks, recreational camps, then water systems, so private water systems, food service, solid waste, the OSS solid waste fund, senior citizens is a grant program that we received a very small grant to do senior health clinics through the Ohio Department, the Ohio Agency on Aging, is that one. The WIC grant, the construction and demolition debris fund, the Get Vaccinated Ohio grant, which is a grant that we received to help us promote and ensure that people are aware of what vaccinations their kids need and when they're due for them. And try to keep them up to date. The integrated naloxone grant, the COVID-19 Enhanced Operations Fund. That is one that will end next year, as you can see. The MRC grant is one that we received just for this year that we do not anticipate receiving next year. That's why it didn't exist last year. That's why there's zeros in the 22 column and the 24 column. Nuisance abatement. The Public Health Emergency Preparedness Grant. The Public Health Workforce Grant, which is intentionally designed coming from the CDC to help build health department capacity. That's the one that we're using to support certain key positions that help us meet the foundation for health services. COVID-19 vaccination, that's a grant that ends this year, so there are no funds budgeted for next year. COVID-19 detection and mitigation also ends this year, so there's no funds budgeted for next year. Indoor radon is a grant that we have not received actually for a while. You just see the existing balance moving forward each year for that, and then the household sewage treatment system program. Then on the back of that page, WIC lead testing, which is a service that was previously done. And that's just the funds continuing forward each year until they're used. Termination benefits is where we move extra dollars that are left over when a grant disappears, and we're allowed to move those extra funds into the general fund to help cover the cost of individuals who are retiring. So those are the various different funds that we have, and you can see there the amount for each on the revenue side, and then individually for the expenditure side, broken out by line for each one of those.
Just out of curiosity, on 141, the from 23 to 24 it cuts in half. I just was curious because it went up and then it drops off dramatically.
I'm not 100% sure why we anticipate a decrease there, and Anita is out sick, so. But I'm guessing that much of that is that, yeah, I'm not sure. Okay. Oh, yeah.
Also, yeah, I also noticed a large jump in contract services.
Right, so that,
C, D, and D, so you're aware, in 2023.
Yeah,
Yeah,
so
yeah,
that's
so
related
I'm-
to our solid waste consultants and our labor.
I just want to make sure everybody saw the
Yes.
number change, that's all.
Which one's that?
Okay, on the revenue funds, estimated, it's expenditures on C, D, and D, contract services.
Oh,
Yes, one goes from $123,561 to $420,000. So we're all aware.
Any other questions? Can I get a motion to accept those?
Second.
Second. All in favor, say aye.
Aye.
Motion passes. Next is the cash, 5C cash advances. That is number 30,000 from 7060 -0705 -5358 and is a general fund advance out to 7082 -0007 -4029 -00 with advances in. That is our only cash advance. Can I get a motion for that?
Motion to approve.
All in favor, say aye. From
Aye.
discussion, wait a minute.
Sorry.
All right, we have a discussion.
What are we advancing to try to cover? You know,
Well, basically the program until the next reimbursement. So you're covering the expenses of the WIC program until, so that they can then cover the costs until the reimbursement comes back in the grant.
big lump sum of money.
Well, it's because they try not to do it multiple little times. You try to estimate how much you're gonna need for the rest of the grant period. Do it once.
All in favor, say aye.
Aye.
Motion passes. Next. That is the 5D inter-fund transfers. Number 1 is $60 from 7062-0036 -5306 water system leases to 7062-0036 -5309 -00 to water systems. Other expenses. Number 2 is $50 from 7164 -0709 -5308 -00 to HSTS advertising and printing to 7164 -0709 -5303 -00 HSTS supplies. Number 3 is $3,000 from 7060 -0705 -5102 -00 general fund salaries to 7060 -0705 -5306 -00 for general fund contract services. Can I get a motion for those? Second,
I'll second that.
and any discussion on those? Is number 3 basically to cover salary for?
This is the cover contracts.
Contract service.
All in favor, say aye.
Aye.
Motion that carries. 5E supplemental appropriations. That is Fund 7130 Medical Reserve quote for $5,000.
That specifically is cover the cost of a trailer that was part of the grant application, but she hadn't said it. She hadn't done the appropriation of the accommodate.
All right. Motion second. Any discussion? All in favor, say aye.
Aye.
Okay. 5F is contracts and agreements. Number 1, Allen Excavating Inc. for demolition services 3/1/2023 to 12/31/2023, not to exceed $21,500 to payer. Number two, Geofida Fida Inc. for H2 Ohio Home Sewage Treatment Systems, soil evaluations and system design. Frivolous property. 3/15/2023 through 4/28/2023, not to exceed $2,970 to payer. Three is A&D Excavating LLC for H2 Ohio Home Sewage Treatment System installation for the Finley property, 3/15/2023 through 6/12/2023, not to exceed $17,094 to payer. Can I get a motion for those?
I'll move.
Second. Any discussion? Okay. All in favor, say aye. Motion carries. Next is executive session.
Mr. President, before you the session, I actually had a question. Commissioner Goon, wanted to ask it earlier, have you ever adopted a policies, in the organization without court approval or made resident, revisions of those without court approval?
Not that I'm aware of, might be if we had something where it was simply a matter of something that needed, it was just a wording change, it wasn't substantive, but none of those come to mind. Otherwise, procedures, yes, per our policy, procedures don't come to the board, those are handled at the health commissioner level.
I was also curious, in the meeting, in your report to us, I know in the past this body had discussed trying to get back with local community meetings. I know before there was talk about the other task force ones. Have you started going back to those meetings yet?
Yeah, starting next month.
So not since our discussion in December, this body discussion.
That wasn't good enough.
So you're anticipating people. Would I like to move to executive session? Okay.
Point of order, we cannot go into executive session without stating the reason. It has to be financial, employee related, or
For discussion of the commissioner's performance evaluation.
Okay, roll call vote.
Mr. Watson,
Yes.
Mr. Lyons,
Yes.
Mr. Bowden, yes. Dr. Stoll, yes. Mrs. Vitt, yes. Mr. Watson,
Yes.
Dr. Rust,
Yes.
Dr. Wall.
Yes. Motion come out of executive session.
also move.
Everyone in favor, say aye. No action was taken. Now it's time for public comments. I guess this one first. First, we are having Brian Eziak speak. I'm not prepared yet. Okay, then Ben Nutter.
Good evening, board. Appreciate the opportunity to speak. We just wanted to, Ben Nutter, Wind Waste Innovations, Study Farms Info. We wanted to make sure that the board understands that the event that we had on Sunday afternoon was a grass fire, also confirmed by the fire chief of Bascom, Chris Daniel. It was most likely caused by something coming off our flare due to the high winds and the dormant grasses and the low temperatures that we had that froze the ground. And with the high winds, it was allowed to ignite and move across. no structures were damaged, no waste was burning. There is no danger to the landfill at all. So we just wanted to make that very clear. Any questions about that?
Does it affect any of those vent pipes that come off or any of those melded or?
Yeah, exactly. If you're referring to the gas wells that come in, right, and so, interestingly, no, we inspected every one of them, and right afterwards, and we inspected all the rock areas as well, because the liner is underneath those rock water wash falls, they're called. And anyway, none of those were infringed upon and none of them had any damage at all. Interestingly, I'm sorry. Interestingly, when those gas wells pull gas up through and out to the flare, they generate some modicum of heat. And so the areas around those wells where the ground was thawed, if you look at the pictures, you'll see green patches around every well where the fire never burned because it was thawed and wet and wouldn't enable the grass to burn. Where the ground was frozen underneath and it could move uphill, the dynamics of fire, I'm sure you don't want to get into all that, but I'm happy to do that if you would like, but so that they were not, there was no, and there was not an ounce of damage to any structures or any of our infrastructure.
All right.
Thank you, Doctor.
Next, we have Dan Straw.
Hello to all, board, yes, Andrew Stroud from Seneca County. And I just want to start out with a quote from a famous person that once said, "Education is the most powerful weapon which you can use to change the world." And during this pandemic, it just, education, what happened to education? It broke down at every level. This is where it's supposed to begin. For the health of our community, the people that live right around us, from the counties to the state. Nobody educated themselves. I've got our folder full of the information that we researched, and it's from reputable doctors, scientists across the country that were shut down because they didn't have the narrative of the political side of this whole thing. So if we ever get struck with a pandemic again, I hope we have learned something. And I hope our health department starts here and pushes it to the top to get all the information to save as many people as they can save, because there's a lot of people that lost their lives because of the disinformation that was not given to the people. And I'm sure that, I don't know what kind of news sources you watch, but I'm sure everybody's seen the East Palestine. And the EPA has done test after test after test there and said, we're not finding anything. We got dead animals, dead frogs, dead fish. They're not finding anything in the air, anything. But now there's somebody, an independent that they hired, that has come in there. And he said, you have to look for what you want to find, or you're not going to find it. And he's finding all kinds of contaminations. So hopefully I can contact this man and I can have him come to Seneca County and start doing some testing on what's going on out there, that everybody is saying they have illnesses, but the EPA says There's nothing to see here. So hopefully the health departments can start pushing their weight and fighting against the bureaucrats that want to push one issue and say, this is the way it's going to be done. And regardless of what information we get, and there's a lot of good information in here, peers reports, the whole thing. I don't know if anybody's ever looked for any of this, but I'd like to leave this for anybody that would be interested in seeing everything that we researched and the things that we found. And hopefully we'll all be better prepared next time around. Thank you.
Thank you. Thank you. Is there anybody else who would like to speak?
I can.
Come on, sign your name.
My name is Ashley Stahl and, get my notes up. I live like within a mile of the landfill. Spoke last meeting. I have sent out emails and stuff to the board and I'm sure you guys, have seen them and stuff, but I just really wanted to push the fact that I think that we need to have an impact study done before the landfill expands, because we have no idea what the landfill is doing as it is to the farm ground, to the residents, to the wildlife, to the water as it is. That's my main concern. That's what got me into starting to look all of this stuff up. But much less if they expand, you're gonna have higher train traffic, more dump traffic, just everything. There's a lot more to it. And I think that, this isn't just your average run of the mill landfill. You look at Hancock County and it's nothing compared to this landfill here. I think it needs to be evaluated more. And honestly, I feel like it should be put on pause until an impact study can be done, because you're just going to continue. Impact study can take quite a while to get started, much less be done. Things haven't been looked at since the earthquake. Things haven't been looked at, I don't feel like, very thoroughly for a while, especially since COVID. The EPA wasn't coming in person and stuff. So that left some room for things to happen. And I just feel like an impact study would for sure help out and ease our sense of, we don't have a lot of trust and a lot of reason to trust the landfill. So, for the sake of transparency on their end, they say they want to be transparent. They should be all on board for doing this, if there's nothing, if there's nothing wrong. Second thing I wanted to bring up was also if we could possibly do randomized water tests too. In addition to the ones that are already done. I understand the landfill wants to have their own lab person come and joint with the health department, and that's all fine. We can keep those going, but I want to just see if at any point somebody from the health department couldn't show up on a random day. That way, it doesn't have to be scheduled. There can't be any preparation for it. They just have to deal with the test being done, so we can just have more information, more peace of mind. Again, transparency. If nothing is, wrong, we will at least find out that all is good and we can be good to go. And then I also wanted to bring up about so when I make an odor call, I get frustrated because I find out more often than not that the meter girl that comes out doesn't come out immediately. There was one time that I reported a 10 out of 10 intensity, and it was 10 hours later she came out to take the meter reading. A lot can happen in an hour, much less 10 hours, which was insane to me. I don't know who oversees that or, what happens there, but I just don't think that, that is the job. That's what she's getting paid to do. It should be an immediate come out to the scene and take the test. Lastly, I just wanted to see, I've messaged Austin and everything about the water test results and everything, and he keeps saying that there's a consultant's report, which I've also heard Ann say the same thing. Where can we see that? can that be given to us so we can see the results of our water and everything and finalize all of that? So, thank you.
Come on up and sign up, whoever else would like to speak.
Hey Ben, how deep is the liner from the surface of the grass?
Who are you?
Very low, resident of Seneca County. I was just curious how deep the liner is from the sort, the fire.
Or would you like us to respond?
What is the barrier?
You can ask them questions
Yeah.
later, but.
Oh, okay. I was just curious. My question, I guess, was, the
Okay.
fire was burning, the one side of the hill.
Actually, yes, answer the question. Has to do with the fire.
Yeah, it has to do with the fire. I was just,
We can provide a response to the board. Yeah, for sure.
okay. Anyways, since the liner is not very thick, that amount of heat, only being, possibly a couple of feet away, how was any of that checked to see whether it was,
All of it.
so you took off the whole side and
No, we check, well, we'll.
I'm asking a
provide
question
response.
again.
Whatever I say, you're going to say something that would make it look.
No, I'm just.
We'll respond to the board, that's fine. Thank you.
Okay. Anyways, also, as we saw in Palestine, the EPA, didn't even take over the testing. They left it to the Norfolk Southern people to test themselves, basically. The EPA trains people in their responses to things that are supposed to happen. What they do is they send out people to take readings, close to it, and then they go out, half a mile, 5 miles, 10 miles, until they can no longer detect what they're looking for, so that they can give a time-weighted average to what people are being exposed to. Snapshots, like, when they come out they get a call, like she was just talking about, and they come out and they take a snapshot, that doesn't mean anything because exposure varies over time. There's also, they don't consider the synergistic effects of pollutants. So if the, SO2 is affecting the lungs and hydrogen sulfide is affecting the lungs, there's synergistic effects where you're getting much more than the individual, that may be fine, but combined, it has an effect. And I was wondering if anybody had ever considered on the health board or some person, employee, to attend like a EPA training for that kind of an event, and if it were to happen, so that somebody here would know if the appropriate steps are being taken. So that's all I had to say.
Anyone else? All right, public comments. I guess this meeting is adjourned. Can I get a motion to adjourn?
I'll second. You can second. Got it.
All right. Thank you.
There you go.